it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com. And just a quick disclaimer, anytime I talk about Invisalign, I have to give a disclaimer. I'm legally required to, according to my attorney. So first of all, I do not work for Invisalign, never have, never will. I make these videos because it's a request of doctors. They ask me a question, they ask me to make a video, and I make it. I don't really make any money off these videos, so they're just for educational purposes only, and they are based on my opinion and my opinion only and my interpretation of what I read and hear. They may or may not be factual. Please verify anything that I say with your own attorney if you have questions, or with Align Technology if you have additional questions. Thank you. Today we're going to answer the question is if there's a penalty if you don't proceed with a ClinCheck. And up until yesterday, my answer was a resounding no. There's no penalty. You can go ahead and do a scan with your iTero, or you can send an impression in, get your ClinCheck. Matter of fact, you should do this. Show your patient the ClinCheck. Patient may or may not choose to proceed. For the most part, you're educating the patient. Sometimes they decide they want to do some restorative work first, and then they might decide to do treatment later, but there's no penalty fee. Now, there's always been a little bit of an arbitrary question in the terms and conditions, at least the ones that I opt into every year, that says they could penalize you, but they never have in the US or Canada, although I just found out yesterday that they are penalizing you if you are in Australia. And I did not know that they were doing that up until yesterday, and I've actually verified it with quite a few doctors that said the fee is $220 at the moment. If you don't proceed, I don't know when they charge it, how long until you have to approve it. I don't have the nitty gritty because I don't have access to their accounts, and nor do I even really want to get into that. But it's huge because the way I see it is if they started doing that in Australia, what if they started doing that in the US and Canada? It will 100%. First of all, I think it's a dumb move on the part of Align Technology, because right now there's plenty of doctors that are on the fence to hopping to other aligner companies. They're beta testing them, they're checking them out, thinking about doing in-house. Yes, you can't do all the most complex cases, but you could always start with braces and then do the white label or do these alternative aligner companies if you had a really, really, really hard treatment, really, really hard plan. So yes, some of the bells and whistles are proprietary for Invisalign, but that's not all the cases. It's a very small percentage of the cases that you couldn't do with another company. So all I gotta say is if they pull this, I mean, I'm not happy about it in Australia because my clients are going in Australia, and it's really a barrier, because now these patients have to put a deposit down in order to do a ClinCheck. I mean, the doctors aren't gonna eat that fee, and I think it's a dumb move because it's going to significantly decrease the amount of cases that doctors are going to do, because a lot of patients, they're not really interested until they see the ClinCheck. And an iOS or outcome simulator is not the same thing as a ClinCheck. ClinCheck goes way more into detail, how we're going to do this, what we're going to do when, the staging, everything like that. Are we going to distalize? Are we going to open the bite? Are we going to wear elastics? Are we going to use bite tabs? Are we going to use power ridges? All these different things and how they work. An iOS is just a really rough simulation. It means nothing. Are we going to use extractions, etc.? Yeah, I'm not happy about this at all. And if they switch, I've been very neutral. I've been very Switzerland about Align Technology. I mean, I like it. I chose it for my daughter's treatment only because her case is so difficult. There was no other company that could handle it. Some of them, you know who you are, like to say they can, but they can't. They have zero proof that they can do it. So until I've seen proof, my kid is not going to be the guinea pig. So, no way. So show me the proof that you can do a case like this, and to ideal, not just start a case like this, and then I'd consider that for my child. And you should think the same way with your patients. The proof is in the outcomes. Show me the finished cases to ideal. Show me your treatment plan. And if you can, that's great. But I haven't seen it with any of these other companies. And my daughter had an impacted canine, and it was until I saw the treatment plan that Align Technology showed at the 2020 Orthodontic Summit, where someone else had a case like this, then I was like, aha, I understand how you did that. Okay, I now trust you to my daughter. So that's kind of how I feel. So in any case, I'm very concerned about this direction that they're heading. I understand that their treatment planners are sometimes doing work, but I'm sure it only takes them, 10 or 15 minutes. And they're going to have so many more cases if you can show the case to the patient, you know? And the workflow is really different. The workflow that I've always told doctors to use is scan every single patient that comes into your office. It doesn't matter if they're saying they're interested in ortho or not. You scan them, you show them the ClinCheck, you educate them on the risks, benefits, and alternatives of treatment. Sure, sometimes they don't do treatment. Sometimes they may decide they want braces. Now, usually, if you have your confidence up, and if you listen to my other videos and read my book, you will know that if you charge the same for Invisalign and braces, and if you have your confidence on how you handle plastic, 99 times out of 100, nobody's gonna pick braces, especially when you explain, especially after COVID, where you have to come so often and wires can poke and break and all the food restrictions. Why? Why would you? I mean, a lot of times parents think, oh, braces were good enough for me, so they're good enough for my kid. But when you remind them of the discomfort, and even when you go into the physiology of it, the high forces, how it's not as healthy for the teeth and gums, you know, and how forces are meant to be slow and low. And when you go into the why, it's not just the colors and the bling of it. It is what's healthier for the patient is aligners, always. Now, there's a very few circumstances where things might be slightly quicker with braces, but for the vast majority, things are actually quicker with aligners. And I yet have a teenager or a kid that is to be non-compliant. I mean, obviously, if they're gonna be non-compliant with aligners, like outwardly and say I am, well, they're gonna be non-compliant with brushing and breaking brackets too. And that's gonna be a heck of a more of a headache for the family and the kid and the office than it would be for aligners. So, and ultimately, if they're non-compliant, you just charge them additional fees, you build it into your contract, or you discontinue treatment early. That's their problem, you know? Just because they're being compliant with, they're wearing the braces doesn't mean they can completely avoid being compliant, because compliance is still a part of braces. It's just much more dangerous than with an aligner. So anyways, I really hope Align Technology, I know you do listen to my videos, please stop charging doctors $220 in Australia for a ClinCheck if they don't proceed. I understand if somebody was doing 100 ClinChecks a month and only 1% started, okay, you can have something like really ridiculous in there where they're clearly using it for something else, but the vast majority of doctors are using it to create awareness, educate patients, and they're really trying. And yes, they may not always proceed, but it really helps them grow the Invisalign in their practice. And especially the doctors who invested in an iTero, that's absolutely ridiculous. And if they didn't invest in the iTero and they're sending impressions, they're not gonna do that many anyways, because that costs money and it takes time and it's disgusting. And nobody's gonna wanna take impression unless they even were considering doing it. So that's kind of how I feel. And as long as we're talking about scanners, I really like, and you can watch my other videos on how at least they're temporarily accepting Meta and 3Shape scans. There's an export feature on how you can do it. I don't know if someone said they might have stopped it. I hope they did it. I think that they should just charge an additional fee for those scanners. I think that would be fair, of, you know, maybe $100 per patient or something nominal, just for the inconvenience factor, you know, of maybe not using, or think of it this way, maybe you raise your fees and you offer a discount for those who are using the iTero, whatever, however you choose to do it. But I really hope that they'll continue doing that, because that has really increased the volume from a lot of doctors that I work with, and they're super happy. And I got a lot of doctors, honestly, to sign up for Invisalign, just because now they're accepting all scans, which is huge. You know, I said, you should really sign up for Invisalign. This case would be way better with Invisalign. So again, for those of you who are from other aligner companies, I'm not saying Invisalign is better. It is an option that's out there. At the moment, it is the best option as far as I'm concerned for complex cases. I said for complex cases. I did not say for moderate or easy cases. I think it turns out the same if you do those. But it is the best option for very complex cases. If you disagree with me, you want to send me a cease and desist, you want to be nasty and tell me that I'm saying the wrong thing. I'm not naming any other companies and saying that you're worse than Invisalign. I'm just saying that Invisalign is proven better for complex cases unless you can show me finished cases before and after with your setup, with photos before and after, with final x-rays. You can't say that your product is just the same, because nobody, not ClearCorrect, not any other aligner company, has done that for me yet. So proof is in the outcomes. Proof is in the research. You haven't shown the research, therefore you're not as good. I'm just saying it. Again, I don't work for Invisalign, just my opinion. All right, thank you.